Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks and then we'll open the floor to questions. I now turn over to Dr. Hinshaw.
Thank you, Lisa, and good afternoon, everyone. Due to a scheduling challenge, we unfortunately again do not have sign language interpreters available today. I'm sorry for the disruption this causes for deaf and hard of hearing Albertans. As always, a summary of my update will be shared on my Twitter account later today, and the full transcript of my remarks will be posted to alberta.ca tomorrow morning. Over the last 24 hours, we have identified 2,370 new cases of COVID-19 and completed 7,338 tests. Our positivity rate for lab-confirmed cases is about 34%. With respect to the more than 2,500 schools in the province, Alberta Education has confirmed that as of February 2nd, 19 have shifted to temporary at-home learning to address operational challenges. Of these schools, 4 have fewer than 40 students total. Across the province, less than 1% of schools are currently operating online. Looking to hospitalizations, there are currently 1,584 people total with COVID-19 in hospital, including 112 in the ICU. Sadly, 15 new deaths were reported to Alberta Health over the last 24 hours. My sympathies are with their loved ones and every Albertan who has lost someone they cared about, no matter the cause. Today, I would like to provide an update that we are making to our quarantine recommendations. Effective immediately, we are updating our recommendation for quarantine for asymptomatic, unvaccinated household close contacts of confirmed cases to align with other jurisdictions in Canada. Starting today, we recommend that these individuals stay home for 10 days after exposure instead of the current recommendation of 14 days. This applies to all Albertans, including those in continuing care. Reducing the length of time recommended for unvaccinated, asymptomatic household contacts of confirmed cases to 10 days from 14 days aligns with data showing the incubation period for Omicron is shorter than previous variants. As new evidence emerges, we will continue to review the appropriateness of the duration of the recommended quarantine period. Our data is indicating that we are likely beginning to turn a corner with this fifth wave. While this is encouraging news, there are steps we need to continue to take to protect ourselves and each other. In particular, vaccines remain critically important. The booster dose has been shown to strengthen protection against severe outcomes from Omicron, including hospitalization. Getting fully immunized against COVID-19 doesn't just protect an individual, it also helps protect those around them. It helps us all by easing the strain on hospitals and our frontline healthcare workers. I also know that due to widespread transmission, there are questions from Albertans about whether they need to be vaccinated against COVID-19 or get a third dose if they have previously been infected with the virus. I believe the best way to combat hesitancy is with accurate information, and I would like to answer these questions. There is evidence that recovery from COVID-19 with earlier strains provides some protection against future reinfection, but we don't know how strong that protection is or how long it lasts. The level of protection from infection-acquired immune responses will vary in each individual. This level depends on how mild or severe their prior infection was, the time elapsed since they have recovered from infection, their age, and whether they have a compromised immune system or other medical conditions. The evidence is also clear that those who have previously been infected and who also have received vaccine have a significantly stronger level of protection than recovery from infection alone. Regardless of whether or not an Albertan has antibodies from a previous COVID-19 infection, getting fully vaccinated with all the doses we are eligible for is still the best way to make sure that we and those around us are protected against severe illness and outcomes such as hospitalization due to COVID-19. There are also questions about how long people should wait to get their vaccine after recovering from COVID-19. There is no set waiting period in Alberta. People who have recovered from COVID and have no contraindications to the vaccine can choose to receive it as soon as their isolation period is over. This applies to first, second, and third doses. There are advantages and disadvantages of different timing options: receiving vaccine immediately or waiting a few weeks or months after recovery. If you have questions about what time frame might be best for you, I encourage you to speak to a healthcare provider, and you can also read the available information on our website. In closing today, I want to speak briefly about the concept of moving to an endemic approach to COVID. My colleagues in other provinces which are farther ahead in the Omicron wave and where hospitalizations are declining have been speaking publicly about the fact that we need to plan and move towards a different way of managing COVID. I agree with my colleagues that this is the direction we need to move when we see similar trends in our acute care system in Alberta. This is a shift in thinking that can be challenging, given that we have needed to use extraordinary tools at our disposal over the past several years to protect our health system and our communities. What I want to be clear about is what moving to endemic means. COVID will not go away. There will continue to be impacts on our acute care systems that will rise and fall with seasonality and new variants that may emerge. We cannot prevent all negative outcomes from COVID, and we must be ready to respond to new information. What has been important throughout the COVID response is seeking balance between the harms of COVID and the harms of the measures needed to prevent an overwhelming surge of severe outcomes. I believe that after the Omicron wave has subsided, the risk of our system becoming overwhelmed will be substantially reduced, and this will enable to shift our response. This change will take time, and we need to continue monitoring severe impacts and any changes to the virus. But we cannot continue to use restrictions in the long term once the risk of system overwhelm has passed. Our acute care system is still under strain today. We need to continue to protect it, and by extension, all of us. However, it is also true that in the future we will be able to remove restrictions, and indeed we must continue to balance our response to minimize all harms across all areas. The pandemic has never had one single right way to respond, but what is always true is that the actions that each of us take every day matter to our communities. Thank you, and I'm happy to take questions.
Due to scheduling today, we will need to wrap up at about 4 p.m., so we'll try to get through as many questions as we can. Please limit yourself to one question and one follow-up. We have one reporter here in the room, so we'll get started and then move to the phone.
Hi, Dr. Hinshaw. Janet French from the CBC. Has the restrictions exemption program been achieving its objectives? And if so, what objectives do you think it's achieved?
The restrictions exemption program was put in place in September in the midst of our fourth wave with a dramatic surge of Delta, which was causing very significant strain on our acute care system, in particular in ICUs. We saw that with the implementation of the restriction exemption program, our vaccine coverage rates went up very significantly, as there was added incentive for people to get the protection that vaccine offers to those who receive it and to those around them. We also saw that in those locations that had the REP implemented, there were reductions in the risks of transmission because of the fact that those who were in those locations were fully vaccinated or had that recent negative test. So the restriction exemption program has certainly had a significant beneficial impact. We know from our current data that Omicron is escaping both previous infection protection and vaccine protection at greater rates than the Delta variant did. But we also have seen evidence that having 2 or 3 doses does minimize the chance of onward transmission in someone who has a breakthrough infection compared to someone who is unvaccinated. So there is still benefit in ensuring that we are protecting our communities through vaccination.
Janet, do you have a follow-up?
Yeah, just to follow up on that. I mean, in your mind, would Alberta continue to benefit from having a restriction exemption program, and why or why not?
The decisions about policy, including the length of time the restriction exemption program is in place, are decisions that are the purview of elected officials. With respect to the impact of vaccines, again, vaccines continue to be very important. They are important at protecting the individual who receives that vaccine as well as those around them. And so I would continue to encourage Albertans to receive all vaccines they're eligible for, as it's clear that with the Omicron wave, the third dose is particularly important at minimizing the risk of infection and also the risk of severe outcomes.
Thank you. Operator, could you please put through today's first caller?
Thank you. Sarah Chu, City News.
Hello, Dr. Deena. My first question it connects to the ones that you just answered, but with hospitalization for COVID still high, burnout in the medical system still present, are you on board with Premier Kenney saying that the restrictions exemption program could be lifted soon?
I am not aware of any final decisions around timing of lifting of restrictions. I want to emphasize that, as you said, the acute care system is under strain, and it's critical that all of us play a part in minimizing the spread of COVID to protect the system, and that includes all of the actions we take every day and choices around vaccine.
Sarah, did you have a follow-up?
Yes, I do. So concerning long COVID and how many people can't work full-time, if at all, because of their debilitating symptoms, would you consider long COVID a disability, and would the government consider creating financial aid to help sufferers?
There is still, as you know, a lot of research that we need around the effects of what's variably called long COVID, post-COVID syndrome. There's a few different names. We're working with Alberta Health Services on some different projects to understand the impacts and how that plays out in the lives of individuals who are impacted by it. Those people who are suffering from longer-term impacts of COVID can access services through Alberta Health Services in terms of the healthcare needs that they have. With respect to financial compensation for those who are experiencing a medical condition that renders them unable to work or to participate in activities the way they used to, that would be a question that I would have to take back with comms and determine which of the portfolios might be able to answer that. But ultimately, anyone who's experiencing a medical condition that means that they are not able to work, it's my understanding that there are programs that exist to support people who are experiencing those kinds of conditions.
Thank you. Operator, could you please put through the next caller?
Thank you. Helen Pike, CBC.
Hi there. Thank you so much for taking my question. I'm just wondering, I know that you spoke yesterday, I believe, about rapid tests coming into the province. Do you know, is that the first kind of delivery we've had in a while? Can you kind of detail, how long we've been waiting on these and how the flow is into the province now?
We can provide more specific details on volumes and dates offline. What I can say is that because of some of the supply chain challenges that we've experienced with the increase in demand globally, that the supplies that we had anticipated that we would receive in late December and early January, many of those shipments were delayed to late January, early February. So as you likely know, in the early to mid part of January, what we needed to do was prioritize the available supplies to healthcare settings and schools. And this week, we have enough that we're able to begin restocking pharmacies, the Alberta Health Services locations that are sites for distribution of rapid tests, as well as sending additional rapid tests to First Nation communities. We will continue to make rapid tests available as long as that supply is available to us.
Helen, did you have a follow-up?
Yeah, I'm wondering if we are expecting regular deliveries or if we're still in this situation of, kind of waiting around for sporadic supply chain related delays.
I think it would be best to follow up offline, just in terms of being able to give you the exact numbers of what we have on order, the dates that we're expecting those to arrive. We have different programs. There is the workplace regular asymptomatic screening program, and then we also have the distribution of kits to those who may have symptoms and need it to determine if they have COVID or not. And so there are different volumes in each of those different programs, different timelines. So we'll follow up offline and make sure you get that information.
Thank you. Operator, could you put through the next question, please?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. You said you aren't aware of a set time to ease restrictions, but the government party has made clear the restrictions exemption program will be canceled in the coming days. Would you support an announcement tomorrow to cancel the REP by the following Monday?
Decisions around policy are the purview of elected officials. The choices about timing and how that policy is implemented are theirs to make as they consider all of the factors that are part of their considerations. I would urge all Albertans, because of the strain that our healthcare system is under, to continue making decisions that protect the healthcare system and protect our communities. And then the policy decisions, again, are made by those who are elected.
Kevin, did you have a follow-up question?
Yes, I understand the decisions are made by those who are elected, but it's your job to give them the advice. So once again, would you support announcing tomorrow? Is it a good idea, in your opinion, if tomorrow the announcement comes that the RAP will be canceled by the following Monday?
I have provided my recommendations to elected officials, and the recommendations are under cabinet confidence. They're aware of the recommendations that I've provided based on current state and my perspective. And they have always taken my recommendations into consideration. However, that's not the only factor in the decisions that they make.
Thank you. Operator, could you put through the next caller, please?
Jason Markusoff, Maclean's.
Thank you very much. What is the difference of transmission risk between somebody who is unvaccinated and vaccinated during Omicron, and how does that compare to the relative risks with Delta?
So some of that level of detail we don't have available in terms of the specific transmission risk of an individual. What we've seen is that the protection level that 2 doses of vaccine offers against infection with Omicron has fallen. So depending on how long it's been since that second dose was received, at about a 6-month time frame from when that second dose was received, there's not a lot of protection left against a person getting infected with Omicron. Thankfully, there is still a level of protection against severe outcomes. So that person who has 2 doses is less likely to go on and need hospitalization or have other severe outcomes. However, again, they can get infected. There is a reduced chance of that person with 2 doses passing it on to others, but that protection is enhanced when you look at 3 doses. That boosts protection up to about 60% level of protection against infection with Omicron, and boosts the protection against hospitalization to 95%. So again, vaccines are still important. That 3rd dose is particularly important with Omicron, and even the 2 doses help against severe outcomes.
Thank you. Jason, did you have a follow-up question?
I do. Dr. Hinshaw, with respect to COVID-19, would you feel personally as safe going into a restaurant that did not check vaccine status as you would dining at a restaurant that did check for vaccine status or proof of test?
Personally, I have not eaten in a restaurant for more than 2 years. So I think it's important that everyone assess their risk level and determine what choices are right for them based on the particular context, their own risk factors, and what the kinds of specific risks they may have in their own life and how they wish to navigate them.
Great, thank you. Could we please, operator, put through the next question?
Paula Tran, Global Calgary.
Dr. Hinshaw, thank you for taking my question. I wanted to ask about the restrictions exemption program again. We've heard in the past few days that the Premier wants to lift the restrictions exemption program, but given the amount of deaths we've seen in the past 2 weeks, can you explain the reasoning just so that we can understand?
I'm afraid I'm not able to speak on behalf of the Premier.
Did you have a follow-up question?
I do. In the past few days, we've seen some medical professionals in Canada calling on provinces to mandate a third dose on vaccine passports. Are you considering this for Alberta at this time?
With Omicron in particular, that third dose is very important with respect to minimizing infection risk as well as enhancing the protection against severe outcomes. Policy decisions around the mandates in terms of restriction exemption program are decisions of elected officials.
Thank you. Operator, could we please put through the next caller?
Rick Bell, Calgary Sun.
Good afternoon, Doctor. I know it might be tiresome for you to get the people asking the same question, but this is really a pivotal question. I understand you're an advisor, not a policymaker. I realize you're unelected, not elected, and I realize there's something called cabinet confidence. But I think Albertans would like to know, no matter where they stand on the COVID issue and the COVID question, is as a doctor, do you believe that under the current conditions that we have, the hospital numbers that you outlined, the ICU numbers that you announced today, do you believe that this is the right time from a medical point of view to remove the vaccine passport? Yes, there are other factors. There are other factors that the government has to take into account, but just on the narrow metric of that you're dealing with, you know, the health situation, what is your diagnosis?
I think, Rick, that you have answered your own question. I know it sounds like a simple yes or no answer. The reality is, again, that I have provided my advice that is, as you say, under cabinet confidence. I continue to underscore that the healthcare system is under significant strain and that the choices that each of us make, the actions each of us take every day, they matter to our healthcare system and to everyone around us who may need care for any reason, not just COVID. Then, as you say, the decisions about all of the different competing considerations are decisions that elected officials are empowered to make.
Rick, did you have a follow-up?
Yes, a quick one. So, as an advisor to the government, how do you feel when, in the course of about a week, we've heard that maybe we can get rid of vaccine passports by the end of March? Maybe we can get rid of all restrictions by the end of March. Maybe we can get rid of vaccine passports at the end of February. Maybe we could get them next week, in a few days, very soon. When you hear, when Albertans hear all of this happen in the course of 7 days, very, very different messages, how does that make you feel as a person advising the government? Because we've gone from vaccine passports gone at the end of March to vaccine passports gone at the end of February to vaccine passports maybe gone on Monday, and this has all happened in just a few days.
There are a lot of considerations that elected officials have to take into account, and so I can't speak on their behalf. I can understand that it could be confusing for Albertans to understand if it is still important to minimize COVID risk or not. I just want to underscore again what I had said earlier, that it can also be confusing to hear different provinces begin to signal their way forward in terms of easing measures. And I think the important thing for Albertans to know is that our healthcare system remains under significant strain right now, and that other provinces are ahead of us in the Omicron wave. And so the the ways that they're beginning to talk about Omicron are appropriate to their context. And what we need to do is look at our context and the multiple factors that weigh into that. So I would continue to urge Albertans to be cautious, to be mindful of their communities when they decide what actions they're going to take.
I understand there's one question left in the queue, so operator, could you please put through our final question?
Duncan Kinney, Progress Report.
Hello, thank you for taking my question. My question has to do with, the many failures of you and the government of Alberta to stop the spread of COVID. And now we've got reports, credible reports, that the government of Alberta is seriously considering getting rid of the restriction exemption program, the vaccine passport program, on Monday. If that were to happen, would you resign?
It's important when we look at the past 2 years to consider how Alberta has experienced COVID in the context of a global pandemic. And what I can say from my own personal responsibility is that I have always, in every situation, done my best to provide recommendations based on the information I had at that time and what I believed was in the best interests of the overall health of Albertans. We have had to focus on COVID infection in a way that we have never had to focus on any infection before. And as a result, there have been other health issues that have gotten worse, and some of the restrictions that we've needed to implement have also had harms. So certainly I have made mistakes, I have admitted to that, and have apologized, and I will continue to provide the advice that is the best I can offer based on the information at the time. And ultimately, the decisions that elected officials make are their responsibility, and I cannot speak for them, and I do not direct them.
Thank you. We are out of time, so that concludes today's availability. Thank you for joining us, and have a good evening.